Today we're getting ready to talk about binge eating disorder and how it affects the VCU students. We're going to talk about shame, different symptoms of binge eating disorder, interventions, community resources, and offer a safe place for individuals to ask questions. Hi guys, welcome. My name is Adina Silvestri and I am a licensed therapist in private practice in Richmond, Virginia. I specialize in treating women with substance abuse issues, and another subspecialty and a real passion of mine is treating individuals with binge eating disorder. So today I just want to have a conversation about binge eating and talk about the shame that is associated with binge eating, and hopefully we'll get the discussion started, and it won't stop here. So what does it mean to be only as sick as our secrets? What does that mean to you? We are only as sick as our secrets. Yeah.
That if you keep a secret that you're sick, then you're just gonna stay sick. And if you're not getting any help, then you're not gonna get any better.
Right, right. So the idea is to talk about this disorder, to tell people that you care about, because you don't know what they're struggling with. They may have similar issues with food or with drugs or with alcohol, and so it really just promotes hope. I'm going to tell you a story about Miranda. Miranda is an individual that came to me about a year ago, and she really helped me to understand the disorder a lot better. Miranda was a 20-something college student, and she was at the top of her game. You know, straight A student. She was also a competitive bodybuilder. So from the outward appearance, you would think, well, you know, Miranda, there's nothing wrong with her. I mean, she looked great, but she was suffering in silence. And so she presented to me with anxiety, just about, you know, college life in general, depression. But it wasn't until she started talking about the way she felt when she looked in the mirror, the self-loathing. And then she said something that really triggered me. She said, you know, I had a cheat meal today. I said, what does that mean? Who here knows what a cheat meal is? Yeah, okay. And I said, okay, so this isn't just anxiety, depression, right? This is something more. So Miranda really introduced me to binge eating, and she let me know that if you don't ask the questions, you're not going to get any answers. So you know, it's not, you know, binge eating it's all around us. You know, it's with athletes, men and women. So just to kind of give you a different perspective of what, you know, the face of binge eating looks like. And I'll be talking about Miranda as I go through my little presentation here. So social media definitely plays a big part in how we view ourselves. Who here is familiar with the the 3 Sports Illustrated covers for 2015? Yeah, what was different about those covers? Yeah, plus size model. Who else was on the cover? Somebody that was not the typical Sports Illustrated model, right? Was it mixed martial arts? Right? Right. Ronda Rousey. So that was different. Sports Illustrated really took a chance. And if anyone gets an opportunity to see Ashley Graham, the plus size model's TED Talk, it is very inspirational. I highly recommend it. You know, she really talks about just always being told from a very young age that she was the pretty fat model. and just always qualifying her looks. She would say, "I'm a model," and they would just kind of look at her cross-eyed. Really? So now she has the last laugh, which is great. Okay, so you have a handout, the top 10 questions to ask yourself. If you don't have a handout, I'm sure we can get you some later on. So I'm just going to spend a little time talking about this. These are some questions that you may want to ask yourself. You may want to give it to a friend, gently. But number one is eating much more rapidly than usual, right? In a discrete period of time. So maybe in about 2 hours. Eating until uncomfortably full, and then you feel guilty afterwards. So you're past the full threshold, right? You're eating large amounts of food when not physically hungry. So you're not just eating a few pieces of pizza, you're eating the whole box. You're not just eating 1 or 2 cookies, you're eating the entire, Chips Ahoy box. Eating alone because you're feeling embarrassed about how much you're eating. So with Miranda, the woman that I talked about earlier, she would just wait until all of her roommates were gone, and she would hole up on the floor of her kitchen in front of the fridge, and she would just eat. It's shameful, It's something that you feel bad about. Shame and guilt, as you know, are very different feelings, and you don't have to do something bad in order to feel shameful. It's very secretive. No one has to know about it. Feeling disgusted or ashamed with yourself, feeling depressed that you've eaten as much as you have. So number 6, progressive weight gain with periods of weight loss. So with the bodybuilders that I was telling you about earlier, this was very common. They would eat 50% of the allowed amount that they were able to eat, and then they would have cheat meals, and then the up and down cycle would just continue. They would feel guilty because they had a cheat meal, then they would binge some more. It was just a really horrible cycle. Avoidance of feelings, number 7. If you're with a therapist and your therapist isn't talking about how you're avoiding your feelings because you're binge eating, that's a problem. Avoidance of feelings and interpersonal relationships, those are the 2 main issues that individuals that suffer with binge eating disorder have. So, if you don't have to have a bad relationship with food necessarily in order to have binge eating disorder, but if you're upset, if you're bored, if you're depressed, what is food going to do for you? What's it going to do for you? It's going to what? It's going to... Yes, release endorphins, dopamine, the neurotransmitter dopamine, for sure. Right. Okay. So food feels more important to me than to my friends, something that I hear often with my ladies. And again, that sort of goes back to the quote that I talked about earlier, we are only as sick as our secrets. If nobody knows that you need help, if nobody knows that you're struggling, it feels very isolating. So you want to reach out to people. Because there is power in being vulnerable. There really is. It's not a weakness. Number 9, owning shame-based identity and insecurity. Again, this is another one that if you're working with a treatment team, you want to hit. You want to talk about the shame that you feel. You want to talk about what it feels like to look in the mirror, to not be happy with what you see, to not love your cellulite or your thighs that are, jiggling. You want to talk about that. Number 10, again, with the having difficulty with relationships. If anyone knew about this, they would hate me, they would reject me, they would leave me. So let's talk a little bit about resources and treatment. You really want to, when you're looking for treatment, you want to have a PCP that specializes in binge eating disorder. And you also want to have a dietitian that specializes in that as well, and a therapist. And all of those individuals need to be working together. But that's the least severe treatment. The more severe, if you're binging, if you severe weight loss or weight gain and you really need some help, there's hospitalization, there's inpatient care, 24-hour care, acute residential, partial, and intensive outpatient, so that's maybe 3 to 4 times a week. So there are options out there. So I just want to touch one more time on really finding help and finding the appropriate help. Because if the people that you're going to aren't talking to you about your motivation, how motivated are you to get better? How motivated are you to not binge, to not restrict? What is this? How functional is this disorder? What is it doing for you? Or do you have a close relationship with your dad because you guys can share cheat meals together? Do you get more attention because mom knows that you're sick and so she's more, giving? So you want to make sure that you talk about the functional aspects of the disorder. And the treatment team needs to be talking to you about the tools that you have. So basically, when you feel an intense emotion, you need to feel it, even though it's difficult. So with Miranda, we did a lot of expressive art, and I would have her paint. And I remember in one specific instance, she threw a bunch of paint on a canvas, and she said, and I gave her like a time limit, 15 minutes. I want you to, paint a sailboat. I like sailing. So I want you to paint a sailboat. And she said, well, we got to the 15 minutes, and she said, well, I have to keep going. There are still paint on my canvas. I need to finish this. And I said, no, Miranda, the time is up. And she said, well, I'm shaking. I have to finish this. And so really just telling her, Miranda, we just need to sit with this feeling of anxiety, and I need you just to feel it with me just for a few minutes. Really trying to get her to regulate her emotion. It's another hallmark of treatment that you should be exploring with your treatment team. So just to end and pass it on over, I want everyone to go home today and just really challenge yourself. Look in the mirror and challenge yourself to say one positive self-statement. Just one. And put a smile on your face. Fake it for me. Fake it until you make it. And that's all I have. So thanks for coming.
So I'm Carly Lovell, and I teach at VCU School of Nursing. I see some of our fellow lovely students who worked really hard to be there. And I'm going to really switch gears and show you guys a different side of what you can do with something that you're interested in. And I am interested in binge eating disorder, but I'm really interested in addictions that have a binge basis. So we're going to talk a little bit about that. And I'm going to frame it in the guise of my dissertation and Spit for Science that you all are probably very familiar with seeing, the Stall Seat Journal. And hopefully we have a lot of participants in this room that actually did the online survey maybe even more than once and then donated your genetic material, because it really gives us a lot of information as researchers and as students too. So I'm just getting started. I'm faculty at the School of Nursing, but I am getting a PhD along the way too. So I've gone through all the coursework and now I'm in what they call candidacy phase, so dissertation phase. And I think this is good for you guys, not only because you can learn about binge eating disorder and my thoughts behind it and how this process kind of works when you have some research questions, but also, you know, if you're thinking along the lines of furthering your education one day, it'll give you a good idea of how this process can go. So this is me. And let's see, make sure this thing is working for us. Did it go yet? No. Uh-oh. Having technical difficulties tonight. Okay, there it is. All right, so can you guys see it? Oh, the mic? Okay, there. So the purpose of my study is really overall to observe food, and namely glucose. That I know there's a lot of buzz about carbohydrates out there now. So carbohydrates turn into sugars, right? Glucose. So I was interested in really looking at two different things: alcohol binge and then food binge, because they really both, a lot of times the food binge, most of us don't binge on broccoli, right? Maybe broccoli with a lot of cheese on it and some butter, but you know, usually it's not the healthiest of foods that people crave. So I wanted to compare some variables. Genetics, I was curious about, and then I started digging in the literature, and it was interesting. I thought I was the only one that had these thoughts. Okay, that maybe there was a connection between binge drinking and binge eating. But guess what? There's a lot of literature out there that people are doing this research. The interesting thing about that is you would think that intuitively people would agree that there might be some sort of connection, but there's still a lot of disagreement whether there is a connection to binge eating and binge drinking at all. So it's still pretty new, that whole field. So I was interested in genetics, if that plays a role, impulsivity, and if that plays a role. How about stress? You know, does that encourage these binge behaviors? And then outcomes of BMI. Do people that binge necessarily have a higher BMI or not? Maybe not. And I'm thinking about both behaviors here, binge eating and binge drinking. And then do they have heightened anxiety, and do they have heightened depression if people engage in binge behaviors? So just to take a step back and really think about what is binge eating and what is binge drinking, the definition of binge drinking is for females 4 or more drinks in a 2-hour period, okay? And then for males 5 or more drinks in a 2-hour period. And so that's the hard and fast definition by NIAAA, and that's the Alcohol Association. And then binge eating, really that definition's been cultivated throughout the years. There was this woman, a researcher named Dr. Fairburn and then Dr. Belgland, who did an eating disorder examination questionnaire, and they determined really the basis of the diagnosis of binge eating, and that is eating, and this is an interesting definition really if you think about it, but eating what other people would consider a larger amount of food than most within that setting, and that's also over a 2-hour time period. And there's a whole other host of criteria that really deals with a lot of what Dr. Silvestri said and the emotionality behind it and kind of the self-loathing part of it. But that's the hard and fast, that you do have to have that unusually large amount of food in one setting. And we probably all can say, yeah, we've binge eaten before, but then we start to think about like, okay, how often, and different facets of that to think about the spectrum of the behavior. So those really are the definitions of the two behaviors, and I want you guys to recognize that binge eating disorder, I don't know how many of you are psych majors, but if you are, you're really familiar with the DSM, the Diagnostic and Statistical Manual of Mental Behaviors, Mental Health Behaviors, and there's a new edition, the 5, and in the 5, the 5th edition, binge eating disorder became its own disorder, and it was taken from a provisional diagnosis of eating disorder not otherwise specified, which basically meant, okay, we can't find a criteria for someone. They're not bulimic, they're not anorexic, so they're going to go in this category that, you know, had different criteria. To now it has its own, and that's because people were finding that there's a lot more people with this diagnosis. And I will tell you that the word disorder, I wish that it wasn't called binge eating disorder per se, because the word disorder is really past tense. It's almost like English as a second language is past tense now if you're thinking about elementary school. We don't call it that anymore for a lot of good reasons, but we do call it binge eating disorder. So the abbreviation for that is BED, and now in the DSM-5 it has its own diagnosis and its own code. And that's because really, since obesity has risen over the last 30 years, the diagnosis of binge eating disorder has risen as well. We have a lot of access to really crap foods now that we like, right? They're good. So as we have more access, and those foods that used to be expensive, you know, those are the cheat foods, right? They used to be more expensive when maybe our parents were, or at least I can say my parents were younger. Those foods were more expensive, and the healthy foods were a little bit less expensive. But now it's kind of flopped, where our foods that are not as good for us are very inexpensive and very, very readily available. So it's no big surprise that obesity has gone up, and as obesity has gone up, we have more people that we can really put in this category of binge eating disorder. So this is just telling you about comorbidity of binge drinking and binge eating, and 25% of people who have binge eating disorder have a substance use disorder within their lifetime. And I really think this 2.7, which is saying that at the same time folks have a substance use disorder. So this isn't just binge drinking, this is a substance use disorder plus binge eating disorder. I feel like that's low. Why do you guys think that's low? That's probably low. Any thoughts? 2.7, we know it's higher than that, people that have both of those things at once.
People who don't afford.
Bing, 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 yay. You get all the right answers tonight. Yes, it's because both are private, well, binge eating disorder especially, like Dr. Silvestri said, is very privatized behavior. So most of us who binge eat aren't gonna say, oh, guess what, I ate, you know, a whole thing of whatever cereal last night to our friends, right? Binge drinking is more socially acceptable, but binge eating is not. So chances are that number's a lot, both of those numbers are a lot higher. I'm putting this up here to take you back to my journey of research. And so I did this humongous literature review, and I looked through all of the literature, you know, doing different searches about binge eating and binge drinking, and started to try and tease out common themes. And these were the themes that started to come out. And so this was what we call a conceptual framework. So this is a picture that I put together. And I will tell you guys, it's really helpful. It looks simple. It looks like, you know, maybe I just sketched this out in an afternoon, but it was painful to say that no, it was no afternoon. It was a lot of work to get here. And so there's different parts of this that I'm going to test in my dissertation studies, because I couldn't begin to test all of this. So these were the common themes. This stress theme, and all of the different HPA regulations that go with that stress theme, you can see that are connected, genetic factors, and I'll go over what those stand for in just a minute. And then all of these psychological based factors that can feed into these behaviors. There are the behaviors themselves, right? Or the behavior of binge themselves, so both binge behaviors, and then adverse health outcomes that we don't want, and that's just to touch on a few. And again, not everyone who has binge eating disorder or substance use disorder or even binge drinking is necessarily obese or has heightened anxiety and depression, but those are common health outcomes for these behaviors. So why am I interested in the Spit for Science database? Well, first of all, it's an awesome study that our university is doing, and so I'd be a fool not to pay attention. And secondly, it's because in your age range of 20-something, like I think it was Miranda, that's when things start to develop for you guys. You're away from home for the first time likely. You're experiencing stress in different ways. I know high school is really stressful, but you're experiencing a whole different level on top of that. And so things start to come out that maybe haven't come out before in your behaviors. And it's not that necessarily that you're going to develop any kind of long-term trajectory of one of these outcomes, but it is a time where you could be more vulnerable to them. So we want to look at this time because we don't want anything long-term for you all as far as how you deal with stress in maladaptive ways. We want you to learn adaptive ways to deal with stress because we all have stress, right? But it's just how we deal with it. Like if you think back to that example of the patient that Dr. Silvestri had, and she was having anxiety, so she just had to have a moment to feel that but not react, right? So that's why I'm interested in your age range, because I'm hoping that I'll learn something and then can maybe intervene before things become problematic or a bigger problem later. You guys know Spit for Science. I won't go into a lot of detail about that. Hopefully you do know. If not, then you might have been under a little bit of a rock, because it started in 2011, and I really hope a lot of you have participated in it because it's de-identified data. No one knows who you are, but you can, researchers and even your peers can glean a lot from the information because we have so many ethnicities, we have so many students. So my N is what we call it, is going to be about 7,000 students, and that's just from 3 fall cohorts, which is really awesome. So thank you. So I really was interested in this concept of food addiction. You know, why do people, we all know binging can create weight gain and makes people feel bad, so why in the heck would anyone go back and do it again, right? Everyone wants to be beautiful and thin and blah, 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 blah. So why would we even, if we know that bad food is bad for us, why would we overeat it? And why would we, you know, some people do it more frequently than others. So I really felt like there was something behind that addiction component that you can also see and that's been proven in the alcohol use disorder. But surprisingly enough, we know that alcohol has this heritability factor, but there's still, genetics is a brave new world. There's still so much that we don't know about what that really is. Is it metabolism? Is it something to do with the genes that you saw? As far as opioids and dopamine, who knows? You know, there's a lot of different studies out there saying it could be a little bit of both. And then so I was interested in both of these behaviors and comparing them and seeing the psychological and risk factors and the outcomes for those, and then also if there's any genetic overlap. And I will tell you something that I have looked at in your Spit for Science data so far that was really interesting, that kind of goes with my whole premise, is that folks that had a history of a parent with problem drinking behavior, whether it's a mother or a father, both showed higher association to binge drinking or binge eating. So it doesn't mean you're doomed at all if you had a parent that has a history of parental, you know, problem drinking. It does mean you might need to be more aware of yourself and how you react to stress and what things that you go to, whether it's sugar or alcohol. Maybe you are more susceptible to those things as your coping mechanisms, and so you'll have to just, you know, be aware. Almost like, you know, with breast cancer, we know now there's certain things that if someone has that genetic marker, they need to be potentially screened more often, right? So I don't want you to feel like if you have a parent with a history of a drinking problem that, oh no, you're going to be a binge eater or substance use disorder, it's a sealed deal. That's the tricky part about genetics. It's not at all saying that. It's just saying you have to be more mindful of your behavior and aware of yourself, right? So I did find that amongst our Spit for Science participants, which was really pretty cool for me because it was my hypothesis. And it was statistically significant for mothers and for for students of mothers and fathers for both behaviors. So it told me I was on to something, right? And I'm just starting this study, so you'll have to come back really for the rest of the outcomes. But maybe that's next honors college next year, right? So my first aim, and when you're doing a dissertation, you have these things called specific aims. So I have 3. And my first aim is to really see if there's shared SNPs, which those are single nucleotide polymorphisms. Some of you guys are probably in genetics and know a heck of a lot more about this than me. But if they're shared SNPs, or if they're for binge drinking and binge eating, and I'm going to look at 2 different approaches. So a GWAS, I know you guys have probably heard about that. It's a genome-wide association study. And so that's basically a hypothesis-free, let's see, we're going to put these two populations of people together and see what common genes come, what common SNPs come to the surface. So there's that approach I'm going to do, and then there's a candidate gene approach, which is really going to take those addiction-based genes and look at if someone's a binge versus a non-binge, how those outcomes come to the surface there. I may or may not find anything. Time will tell. So this just tells you a little bit more of detail regarding which genes I've chosen. And FTO is an interesting gene. This is a pretty new gene that's associated with body mass, increased body mass, and obesity. So it's not necessarily associated with binge at all. But I will tell you that the dopamine genes, like Dr. Silvestri mentioned, are associated with binge, drinking, and eating. And then the opioid gene is as well, and that 5-HTT is a serotonin gene. So I'm going to look at all of those, and that's the candidate gene approach, and really just compare these different groups here. So if someone has never been exposed to alcohol, I'm not going to look at their genetics because they haven't turned the key for those genetics yet, right? So there are different, I'm going to have to set up the database differently based on what I want to see from it. So, yep, non-drinker versus non-binge eater, non-binge drinker versus binge eater, and blah, 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 all these different 6 outcomes that these groups could form. And I am going to look at stress, impulsivity, and anxiety and depressive symptoms in this study. And then the third aim is to marry the two. And so what I'd like to do is take those genetic results, if I have anything statistically significant, and then take those psychological results, if I have anything statistically significant, and then see what, if I compare the two, what remains, what falls away and what remains statistically significant. And I will tell you guys, I'm not doing all this by myself. I'm going to try and hopefully, keep your fingers crossed for me, get money for a statistician, because I was thinking I would be able to do all of these statistics by myself, and it's a lot. And so when you are in research, just know you need to know the lingo and you need to know your research, but you don't have to know every single facet. You do need to know what the statistician's doing and be able to talk about the results, but I'm not a genetic statistician, so I'm going to work with a genetic statistician on that. And I'm also going to hopefully work with a bio statistician on the other variants. If not, then it'll be very long and painful, but we'll see. So this is just showing you all my dependent variables and independent variables and these covariates. So if you are, I'm sure you all as undergraduates have been exposed to research. You're at a research institution, and so that's how you think about things. And these terms that you're learning now, if you're at all interested in research, golly, they're not going to go away. So you might as well learn what a dependent variable is now, independent variable, and those covariates. And then I just wanted to, you all probably think about when you're doing papers how you're supposed to bring up limitations. And just the same thing applies to research. So some limitations is that, I might not get anything from this genetic yield. As great as you all are and as many people as participated, it just might not give me anything. Some people in genetics think you need a whole bunch of people. 7,000 might not be enough. Some people think you can do what I'm doing with maybe even 7, who knows. But that's a risk. And then because I'm doing this candidate gene approach, maybe my hypothesis is really off and it won't yield what potentially could have been yielded if I had a different frame of reference, right? And then overall, survey fatigue, if anyone did the Spit for Science survey, it's long. And maybe towards the end, you weren't really thinking as clearly as towards the beginning, and you were just like, okay, I want my $10. And maybe you didn't give really thoughtful answers at that point. So that's called survey fatigue. And then you know, evolving perceptions related to constructs that vary based on your environmental circumstances. Are you more likely to binge drink after your last exam? Probably, right? Or maybe before your last exam, I don't know. But anyhow, so based on school and the ebbs and flows of the semester, you might be more stressed and more likely to binge eat, more likely to celebrate with binge drinking. And then the last thing is self-report. You know, the parental history is a good example of that. You may or may not know your parents' parental history of substance use disorder, right? Or problem drinking. Maybe you don't have a relationship with them. Maybe you're adopted. So those types of things go into your outcomes of research too. And then potential impact, really, I mean, it goes back to Dr. Silvestri, and that's why it was such a great experience to have her, who she's practicing in this field, to be able to come talk to you guys, because, I mean, she sees it and lives and breathes it every day, people that are courageous enough to come to her and say they have a problem, or she's learned that, guess what, this is a privatized secret behavior, so now she's asking the questions to make it okay. Because unless you ask the questions, you might not know. And even the people that come in with, for another reason to her office might have this kind of behavior, and they don't maybe even realize that they're coping using that technique, just depending on the spectrum of their behaviors, right? So ultimately, it's to improve health outcomes for all of us, our mental health outcomes and our physical health outcomes. And so to find out more about this etiology behind binge eating disorder, because truthfully, there's a lot of heat and research is whether food addiction real. But guess who knows it's real? Who any guesses who knows food addiction is probably real?
People who deal with it.
People who deal with it, excellent. Who else? Money, companies to make the food, right? Yes. So we need to figure out ways basically to deal with it and cope appropriately to our changing environment. And hopefully even some of this stuff later on down the line could lead to policy changes. You know, think back to New York and the soda and different. I mean, once we're more educated, we can educate the population and ultimately trickle down to policy, right? And let's see, we're almost here at the end. I just wanted to show you the faces of the people who've helped me. And then these folks, Dr. Fazil Aliv is a genetic statistician that's been working with the SPIT for Science data. Some of you might, does anyone know Dr. Aliv? He's wonderful. He's from Turkey and he commutes back and forth. We've actually Skyped and worked together that way. Dr. Amy Atkins, I know some of you know her. Yes, with Active Minds. She is just fabulous. She's a wealth of knowledge. Those two are in the basement of the something Street Gym, the Franklin Street Gym, thank you. And then Dr. Danielle Dick, and she is one of the leads of this whole study. And Leroy Thacker is a statistician, and these are the folks that are on my committee. So when you guys go get your PhD one day, you'll have a committee chair, and you'll have different, bless you, people that are part of your committee that might help you or make your life a little bit more difficult at times. And then we just want to open it up for questions. I do have references here in the end, but we have 10 minutes, so we wanted to give you all the opportunity to just, you know, I know this is a large group, but that's awesome that you all came out and exposed yourself to this topic. What is the tennis player that came forward recently?
Monica Seles.
Monica Seles, yeah. Came forward. I don't know if you all heard that she, you know, said she struggled with binge eating disorder. So it's definitely more prevalent than we even know. And, you know, just wanted you guys to be more aware of this and start to think about how it could affect you, could affect your friends, could affect even our population, you know, and our population health. So questions, thoughts? I know you guys are smart, and there's at least one thought in here based on something that you heard tonight. Is this surprising to you or no? Uh-huh.
Is this something that you only see in like industrial and more developed countries?
That's an awesome question. Yes, it's definitely more common in industrialized countries because, and Fazil Aliyev, the genetic statistician, is from Russia, and he mentioned, you know, when this was not an option, is in the drinking too, at certain points because they just didn't have that kind of surplus. So yes, but as our whole world, our globe starts to become, you know, food shortages still definitely a huge issue, but as our world has less shortages, you are seeing this increase as well. So that could also be part of that, you know, obesity has risen, but also binge eating disorder. Good question.
Have you noticed any trends of comorbidity between like mood disorders and then binge disorders as well? Because I know that kind of goes back and forth.
Yeah. You guys are on it. Yes, definitely. And so that's why I wanted to study the outcomes of depression and anxiety, because they all kind of feed each other, right? And the same thing with any kind of addictive-like behavior. You know, I use the term addiction loosely because addiction really means that you know, you have a physiological need for it. But if you think of the term craving, you know, or chocoholic, or those terms associated with food, it tells us there's an addictive component to it. So when someone is choosing to overeat, even though they know it's not good for them, they do experience shame, remorse, you know, self-loathing that can create heightened anxiety, heightened depression. And, you know, depending on the scope of that, it can be a big deal for some people. So you're right on the money. Other thoughts? Mm-hmm.
Is the number of reported binge disorders increasing, or do you still think it's stagnant?
It's definitely increasing. It's been on the rise for the last 30 years, really pretty profoundly. And like I said, the DSM-5, I think that came out in 2013. And so it achieved its own special place in the DSM-5 because of that increase. Mm-hmm.
Is this, would you say, more of an American phenomenon, or is it across all industrialized?
It is across all industrialized countries. I will say that 2.7% was a worldwide figure. And so it does, and I don't really know the answer to your question fully because I haven't researched that in great detail. Binge eating disorder touches everyone, you know, in countries that have surplus, but I think that 2.7 is probably lower. My guess is because of different countries versus us. But, you know, certainly we're not the only ones with it. So some researchers don't think that there's an addictive quality behind food. They just don't. I mean, it's a hard thing to prove, right? Because we really need MRIs to show the brain light up, and you know, when people are exposed to sugar, show the brain light up. I've told nursing students this, that literally babies, when we circumcise them, a lot of times we'll inject lidocaine around the penis as a pain, you know, deterrent. But some physicians who are really good and really fast think there's more trauma to doing that than not. So they will literally we'll give the baby what we call sweet ease, and it's glucose. So we'll have a gloved finger and put that sweet ease in the baby's mouth. And the next thing you know, the circumcision's done. The baby's very content sucking on the glucose. And that's the anesthetic, right? So, you know, it's a hard thing to prove scientifically.
Yeah, I was just going to add that individuals that come to me, they will self-report that they have a high when they're about to binge eat. Sometimes they'll explain to me that there's a tingling sensation in their face right before they're going to binge eat. So, you know, it's addictive brain, and it's definitely in play there.
And so, yeah, people spend time seeking, you know, the substance.
Think about the substance.
Yeah. Mentally spend time thinking about it. So whether it's like I said, I'm using that term a little bit loosely. It's not addiction where they can't function without that substance, but it definitely has addictive-like qualities. Good questions, guys. Other questions? So you have a counseling center here. I called them. That's how we got connected, and I was really happy to get connected because she does work in binge drinking and binge eating, so it was like, a perfect connection. And I called your counseling center to find out resources for you, and they said absolutely that they address binge eating disorder here. You would just have to call, make an appointment like anything else. There's lots of different groups in the community outside of your university, but I will say right now there's no group at this university, so it's really a lack. If you all, just FYI, had enough people that that could benefit from that. I will tell you at the hospital even, there are employees and then patients that they have a weight loss group really because of this whole thing. I mean, because practitioners believe in that addictive component and that we're biologically wired to crave sugar, to like sugar. So there's a lot more kind of preventative stuff going on out there, and it's becoming more mainstream to talk about this type of thing. And we're realizing that, obesity, and not necessarily everyone with binge eating disorder is going to be obese, but it's something that it's not just exercise and diet, right? There's more to it than that. All right, any other questions? You guys were great to hang in here tonight in this space. Dr. Silvestri, do you have anything else to add?
No. For those of you that didn't get the 10 questions or the other handouts, I'm sure that we have your email somewhere, and we'll get that information to you.
All right, you guys have a good rest of the night.
Well, we were expecting 20 people, and from just talking with the event coordinators, we had over 100 students show up tonight. So yeah, I'm very happy. I'm thrilled. I'm hoping that there are many more discussions that are going to occur tonight and going forward about binge eating, and hopefully reducing the stigma. That it's okay to be honest. It's okay to be vulnerable. It's okay to reach out and ask for help, because we're all struggling with our own inner demons.